Hi, and thank you for welcoming me to this symposium that will talk about teaching climate and health, how to educate health professional students about climate change. This is a seminar series, The Implications of Climate Change and Health, the Interdisciplinary Perspectives. And this is Seminar 3, Pitfalls and Possibilities, Teaching Climate Change and Health. And who am I? My name is Andreas Vilhelmsson. I have a PhD in Public Health at the Faculty of Medicine, Lund University, Sweden. And currently I'm an associate researcher at the Faculty of Medicine and at the Division of Occupational and Environmental Medicine. And I've previously also been at the Social Medicine and Global Health at Lund University. Something to say about me, I have a broad research interest on different aspects of human health. My research concerns issues around global health, environmental health, climate change, mental health, pharmaceuticals, toxicology and pharmacovigilance specifically. Also, I'm engaged in different projects concerning different pandemics and also nudging in healthcare, artificial intelligence and digitalization. Currently, I'm very focused on climate and health, where I'm writing a textbook on the health and medical aspects of climate change. And I'm also very in this process engaged in how climate and health can be included in medical programs and education for health professionals and practicing clinicians. And I was also teaching at the medical program on climate health here at Lund University. So, how can we teach health professionals to combat the effects of climate change? I have now for some time educated in the medical program that I said, and I think it's very important to do certain aspects of this. For instance, it's very important to explain the state of the climate, the scope of the problem, and here it's very important to use infographics. I have found that extreme weather events is very important to show, as it's the most visible evidence of climate change. And it's very important to quite directly focus on the health aspects of climate change, that it also is a healthcare question, and also that the health professional, how they can act as advocates for this issue. And to do this, case studies is very important to have concerning different aspects of climate change. And it's also very important to give tools and resources, knowledge, education, and also explain about available short courses. And I will come back to this. For instance, if we look at extreme weather events, it's very visible for every one of us, and it's also very reported in the news, and it's coming more often, more earlier, and also more earlier and more serious than the climate scientists had anticipated. And basically, it can be important to just say something to students what the science basically says. And if we look at the key findings from the latest IPCC reports, we have some key findings that says that there is no doubt that we are changing the world's climate, and the climate is changing fast, and we keep breaking records, as we will see this summer as well. And extreme weather events have become more common, and also this has also been very visible concerning the oceans that are now, there was a heat record some month ago. And also, if we look at the heat, the past 8 years has been the warmest on the records, and 2023 will probably break that record. And also, there's a increasing likelihood that we will break the Paris Accord 1.5 degrees target, albeit it will only be for a certain time. And as global warming increases, we have these tipping points in the climate system that cannot be ruled out, and also that it is the most vulnerable populations that will suffer most. And it's very becomes very apparent if you look at how we now have the carbon dioxide levels that are highest in human history. And these carbon dioxide levels are also very goes in the same line with the temperature, so we can see how these two hang together. And as I said, this has been the hottest years on records, as these infographics show. Becomes very visible. And we can also, it's very important to explain that these small changes in the average can have big changes in extremes when we see this. We have a previous climate and we have a new climate, and we have more heat and extreme heat days and less cold. And if we look at this figure here, it's it becomes very visible also that the impact of climate change have fundamental changes to the human health and different aspects. And we can see how more extreme weather events and rising temperature also have certain effects on the climate, and also in certain already medical conditions that we have. This will affect all our health, and this will also affect healthcare. And as I said, extreme weather events is quite useful in this regard, since they have been increasing, and also that it's the climate and weather events that has been increasing. We can also see that certain of these, as heat, has increased a lot. And this is also very visible if you look at the last summer, for instance, where we have over 16,000 Europeans that died in the different heat waves that were very severe during the summer. And we also have drought and water stress and flooding. And this we will see this summer as well. And if we look at the future impact of climate change, these will certainly increase. And as WHO now have made some calculation that by 2030, around 50,000 additional climate-related deaths will happen. By 2100, they can be over 9 million climate-related deaths for 1 year if we follow a high emission scenario. And as I said, it's very apparent also that heat is for instance, this in the US, that heat is the deadliest weather phenomenon. So in this WHO graphic, it's very visible also that the health systems and the facilities have a very important part to play. So it's very important to connect the healthcare with climate change. So as I've shown, climate change is already negatively affecting human health. And in the last years, numerous medical professional societies have issued policy statements that call on their physician members to help reduce healthcare's carbon footprints, but also advocate for government policies that reduce greenhouse gas emissions and educate the patient and communities about climate change and health. So this is a very acknowledged endeavor now. And we can look at this. Here it becomes very apparent. This study came out a couple of weeks ago. If we look at these so-called cascading effects that can happen, we will look at climate change. If we have, for instance, a heat wave and a blackout simultaneously, in the case of Phoenix in the United States, this would send half of the Phoenix population to the emergency. So this is a quite problematic scenario. But healthcare is one part of the solution, but also a part of the problem, since we have they're responsible for almost 5% of the total greenhouse gas emissions because of the use of different gases, for instance. As in some countries like the US, the healthcare system is becoming more and not less polluted. So they have a very important part to play here as well. And it is very important that the students acknowledge this as well. There have been some suggestions how we could make some interactive curriculum to teach medical students about health and climate change. It's very important that we could develop some novel curriculum to educate them. and it is becoming increasingly important as we see as climate change worsens, the climate change effect worsens. And this is very important also that this is changing, so it must be based on the latest climate research, since this is a very rapidly evolving target. And here it can be very important that we can have small group discussions and case-based problem solving, so we can build up the skill that is necessary. So, what should a climate and health case study look like? It is very important that it is a solution-driven, that we make sure that the case is concrete and real-life example of progress being made on reducing the impacts, for instance, of climate change on human health. It should also be visible that we share images, video, or graphic elements if possible, as I showed. It should also be diverse, that we can highlight different stakeholders and sectors that are driving positive change, such as representatives from cities, regions, businesses, and civil society, in a different aspect that concerns public health. It should also be personal, that to show the people behind the initiative and share at least one quote or personal perspective, ideally from a person directly involved in the project or from an expert in the field. But it's also very important that it can be short and concise, that it's not more than 1.5 pages or something like that. And I have some examples here. I have 2 real-life examples and also have some clinical vignettes. This is, for instance, the heat event in Canada 2 years ago. In this case, a woman in her 70s showed up at an emergency room in the Western Canada. She was dehydrated and suffering from asthma and diabetes. She lived in a trailer with no air condition as temperatures climbed past 100 degrees Fahrenheit or almost 38 degrees Celsius. And the emergency rooms throughout the British Columbia quickly filled up. And this was a record heat wave in the region that also prompted the answering doctor, Kyle Merritt, for the first time. He admitted the woman to the hospital and also citing the climate change as the underlying cause for her condition. And the problem with this heat wave was that they created a heat dome that broke records, and in total almost 600 people died in British Columbia. And as a cascading event, the crushing heat waves also was followed later by a deadly flooding that killed more than 100 people. And here we could have some discussion points like that students could relate and discuss to how can we use climate change as a diagnosis? Is this viable, and how will we use this in the future? But also that we can look, how does extreme heat, in this case, like with a heat dome, affect the human body? But also, what is a heat dome and what does it mean? And how will the future look like with different warming scenarios? And here are very important and have been many studies made, but also this study, for instance, have show quite clearly how the heat-related mortality has not only increased, but also that it's very related to the human-induced climate change. And here we can see also how the human body is affected in different ways. But also in this event, how the healthcare system also is affected in different scenarios. So the exposure to heat has very many levels of how it will affect us. And this is the heat dome effect. That is, we also had this kind of event here in Sweden 2018, and there is some argument that maybe this will happen here as well this summer. And we also have the urban heat island profile effect to look out for when we have these heat waves that also drive up the temperatures in the city. That also will make it visible that we need more urban greening. And here is some future scenarios from the IPCC that will also clearly show how much more warm it will get depending on the emission scenario. In case number 2, also a real case regarding air pollution. In 2013, a 9-year-old girl dies after an acute asthma attack in south of London. And she had had more than 25 emergency hospital admissions in the previous 3 years. And in 2020, a landmark coroner report made her the first person in the world to have air pollution cited as a cause of death. And one may not think so, but every year in London, between 8 and 12 children die, and 250,000 children in London have asthma. And in this case, there are several questions one can have, but for instance, here it's very important to look at, in this case, it's with air pollution, but in some regards, it could also be climate change as a diagnosis. It's a very important question to discuss, but also look at how does air pollution in this case affect the human body, and how big of a problem is air pollution. And for instance, air pollution affects many of our organs and lead to very many problems. And we can look at the global pollution levels that are quite high, but also very uneven in the world. And it's very important to look at how are people affected. For instance, if we look at to India or China, or compared to, for instance, here in Europe. And every day, around 93% of the world's children under the age of 15, they breathe air that is so polluted that it puts their health and development at serious risks. And in 2016, 600,000 children died from acute lower respiratory infections caused by polluted air. And also we have a very significant group here when the pregnant women are exposed to polluted air. They are more likely to give birth prematurely and have small, low birth weight children. And this is not always discussed. And if we look at the percentage here of the EU urban population that we sometimes think we don't have that kind of polluted air here, but we are also exposed to air pollution concentration above both the EU and the WHO reference values. And there are also some clinical vignettes that one can use. For instance, this is the case of mental health. We have a 46-year-old male represented to your clinic with insomnia, and further history reveals that the patient recently went through a large wildfire in his town, which destroyed his home and neighborhood. And he reports fluctuating between feelings that rebuilding his life on his land is hopeless, but he yet feels incredibly anxious about moving elsewhere, thinking the entire world is ultimately on fire. You live in the same town as the patient and witness the destruction on your community. And here one can discuss these kind of questions at what might be a positive therapeutic response to hearing this patient tell his story. What might be your current psychological and emotional state after having witnessed this disaster? How might that impact the care you provide? Identify sources of anxiety that may exist for this patient. And how can you as a provider approach suggesting modalities of containment? And how might you help this patient reframe his mental framework? And the mental aspects of climate change has not been discussed so much. This is a very increasing important problem. And here we can also see that there are very many different schools, for instance, Harvard or Columbia, that offer already different education and courses surrounding climate and health. This has become a very important topic, and that is this is something that we could strive for instance, here in Europe to establish as well. So we can come in and educate already acting researchers, health professionals, researchers, and clinicians. So we can say that this climate change impacts everyone's health, while seeking to do good, healthcare has also a responsibility to avoid doing harm. And healthcare is in a unique position to address climate change. And healthcare, economic, political, and moral influence can rebrand the climate change as a public health issue. This, I think, is very important, that we can finally make this a health question. In the upcoming climate meeting this fall, health will have finally a seat at the table, and we will see if that is enough. But it is quite astonishing that it has not yet been branded as the health question as it is. And hopefully this gave you something, and you can contact me at this email address if you have any questions. I'm very sorry that I couldn't be with you today, but it's in the middle of the night here in Sweden when you will have this symposium. So thank you.